Good evening, everyone. We will begin just in about 30 seconds. Good evening, everyone. You are here with another episode of Living SickleSMART. I am Ray Blaylark, and I am the Executive Director at Sickle Cell Foundation of Minnesota. And we have such a special show for you tonight. It's one that I've really been looking forward to, something that's near and dear to my heart. Before we begin, I want to make sure that I do all of the proper introductions. Let's see here. You all should be able to see my screen, and if you can't, I'm going to make sure that you can. All right, we want to make sure that we give a special thanks to our partners and sponsors. Obviously, our special guest, Dr. Charles Jonassaint with CaRISMA, Beam Therapeutics, Be the Match, Children's Hospitals and Clinics of Minnesota, and the Sickle Cell Disease Data Collection Project here in Minnesota. We are excited about that, and all of our partners are excited about the work we are doing, and we are glad that you are here to join us. Tonight's session, as I said, something I'm really looking forward to is about managing stress and minimizing pain. In the process, you will hear about Dr. Jonassaint's study, CaRISMA. And if you're going to get as excited as I am, I know you're going to enjoy it. And then, but before we begin, one of the things I want to make sure of, because some of you may drop off a little bit early, I want to make sure you all know about the need for blood. We are extremely short in the blood supply. Anytime we are short, what happens? Not only are we short, but we get shorted. So we need to be, we need to show up. And we need to donate blood. So if you're a person living with sickle cell disease, you can let your friends and family know. If you are a provider or you are a member of the community, we need you to show up and to donate, particularly if you are Black or brown. We need those diverse blood supplies so that we can maintain good matches. So here we go. Can you all hear that?
A little bit.
I want to make sure I'm sharing the sound properly. Sorry, guys.
Transfusions and blood donation are so important for sickle cell because they are what keep us alive. And we literally need to replace the blood that is within us that is failing with new blood.
A blood transfusion can be the difference between a couple weeks in the hospital versus 2 to 3 days in the hospital. It's like having a pot of coffee all at once. It kind of re-energizes you and brings you back to life.
Honestly, you never know if you would be in that situation as well. And I think that's the most important thing in the world that everyone should think about, is that, you know, the time that you take out, you're actually saving someone's life.
It is imperative for the broader African-American community to not just have awareness of sickle cell, but also to be engaged in regular blood donation. That match is what helps have transfusions that are successful.
It's always been really important, you know, because there's always a blood shortage. Some people just don't see the value in it. When I receive blood, I know that it's somebody who has a good heart and is out there and who understands the role that they are playing when it comes to giving blood.
I get this excuse, a lot of people are afraid of needles. Understand that you taking that time out of your day, 15, 20 minutes to donate blood to somebody that can help you save a life. It actually saved 3 lives. I'm grateful for those transfusions.
You giving blood today is another day for another person, another chance, another opportunity for them to live a better life.
Don't fall into the delusion that all blood is the same and that, you know, a transfusion is a transfusion. I would not be here were it not for folks who have seen fit to donate their blood so that I can be transfused in a moment of crisis. So thank you to those who have donated, and please keep donating.
Okay, you've heard me say it before. If you really want to lend a hand, we need you to lend an arm. All right, with that being said, I'm going to stop sharing and I'm going to introduce you to a good friend and colleague. And we have learned so much about one another over the past few years, but even the past just couple of months since working on this project, we have so much in common and our passions are so similar. But I could not do him justice in introducing him anything more than he can do for himself. So I'm going to turn it over to you, Dr. Jonassaint. I want to remind everyone that we want you to participate in the Q&A. You can add questions and comments throughout the session, but if it's a question, put it in the Q&A. At the end of the presentation, we will have plenty of time to talk and to ask your questions. So take it away, Dr. Jonassaint.
Hey, thank you very much. Thank you for having me. Really enjoy being part of this. I, of course, I really want to talk about CaRISMA. But first of all, I do want to just outline a couple of things. First of all, why are we doing this research? It's not just because I came up with the idea, but there's some reasons behind it. I just want to explain that. And we'll talk a little bit about the CaRISMA study. Mental health hacks from CaRISMA. So if you're part of CaRISMA, you'll probably know a lot about the things I'm going to talk about in regards to mental health hacks. And then, of course, we want to have some discussion. But just a little bit about me. I always like to put a picture of my wife so you know I'm not a crazy person. There's actually somebody out there who decided they wanted to actually live with me, hopefully for a lifetime. So I do not have sickle cell myself, but I'm a clinical psychologist. I've been working in sickle cell for about 18 years now. The primary reason that I got into sickle cell is because it just turns out that working with people that look like me and have a lot of the similar experiences to me, really made it so that I was passionate about this group. And as everybody knows about sickle cell, you don't choose sickle cell, but sickle cell chooses you. But I really feel like that the community has embraced me, even though I'm a little bit of an outsider, but I really do appreciate being part of the community and everything that the community is doing to support me, things that I'm doing, but also to support this work, because I think it's really important. All right. You can find me at the University of Pittsburgh, which is this, you see the tower in the background here. It's a cathedral of learning. That is actually one of the tallest structures of any university campus. So small fact. The stress pain cycle. Where did I get this from? This is actually working and hearing stories from warriors. We all know that external stressors happen. Job loss, family conflict, you get hospitalized, you're discriminated against in the hospital, childcare issues, COVID, right? And typically after these external stressors, oftentimes what happens is you do end up with pain. And this is the story that I've heard over and over again. You know, a young man says, you know, I lost my grandfather and ended up in the hospital. Another young lady says, I had to drop out of school or maybe it was some exams. I ended up in the hospital with pain crisis. And we all know that these external stressors lead to pain, but we often forget about the components and the steps that happen before the pain begins. An external stressor happens. Say you have a family conflict, you get into a fight with your mother. These negative thoughts, feeling low, catastrophizing, self-doubt, I'm never gonna be able to make this happen. Maybe you get fired from a job. That feeling of being overwhelmed, helpless, life is spiraling out of control. Depression, anxiety, all these feelings, that irritability, that kind of gut-wrenching anger that kind of builds up, or maybe that feeling of, I don't even have the motivation to carry on anymore. And the other piece that we don't talk about very much is that physiological arousals, the increase in muscle tension, increase in blood pressure, increase in cortisol, stress hormone, adrenaline, your heart rate, and the clamping down of your blood vessels that will eventually lead to a pain crisis or other symptoms of chronic pain. Now, we don't talk about all these things. We don't often talk about depression and anxiety. We're talking about it more now, which I appreciate Ray inviting me. But we don't really think about all these psychosocial factors that are contributing to pain. Maybe the second top contributor to pain crises is probably stress. Now, how are we going to actually address those negative thoughts of depression and mood? A lot of time as a clinical psychologist, I know it's difficult for people to come in to see me. I know it is. It's like transportation issues. Maybe it's just fatigue, like I don't feel like it. Maybe it's money. Your insurance doesn't cover it. You don't have the cost, or maybe there's not a therapist in your area that you can even connect with, right? About 20 years ago, they started using this thing called computerized CBT or computerized therapy. And we have been using it for a long time, and we know that this stuff works. We know that this stuff works. Now you'll see over the last 2 decades, there's been an explosion of these cognitive behavioral therapy or these therapy apps like Happify, Noom, Mood Tools, Mood Fit, Mood this, Mood that, right? Stress Coach. Now, most of them do these standard cognitive behavioral therapy techniques that we know that works. There's a lot of evidence that these things work if you use it. They're more behavioral than cognitive. There's not a lot of cognitive restructuring or anything like that. And a lot of these apps, for them to be effective, a lot of these apps have a health coach component. But the one thing that we don't know is whether, we haven't known for a long time, is whether these cognitive behavior therapy apps, if they actually work for a Black population. Like, do they work with Black people? We have a lot of data that shows that they work with white people, but not very much data to show that these digital CBT apps, they actually work with whites. We actually found in one of our studies that in primary care patients, this is not in sickle cell, this is primary care patients, Black and white, African-American and white, that said they had depression or anxiety. We gave them a CBT app, an online CBT app. And we said, please use this. There's 8 sessions, 1, 2, 3, 4, 5, 6, 7, 8 along the bottom. And you can see that over these values here, these are their depression score at each of these sessions. As they used the app, their depression scores went down. Their depression scores went down, right? Now, the one thing that you can't see on here very well is how many people were using the app at session 1, 2, 3, 4, 5, 6, 7, right? The numbers start to drop over time, but the numbers, although African Americans were benefiting just as much as whites from this digital CBT app, the African Americans were less likely to get to session 8 than whites. And on top of that, we actually found that when we offered this thing, when we prescribed digital CBT, we said, if somebody says, I got depression or I'm anxious, and you have something that's going to help me. Okay, great. Now, how many people are actually going to use it or even open up the app? Well, 10% of the whites didn't even open up the app, but 25% of our African-American patients didn't open up the app, right? Now, we've also done this with a small group of adults with sickle cell, and we found something very, very similar. We didn't see that a lot of the patients were finishing the whole 8 sessions of CBT. And a lot of our patients don't even open up the app. And the question is, are we actually being patient-centered? Are we listening to your voice when we are trying to deliver something that we think works? And you probably answer me, you probably say, no, Charles, you guys do not listen to us. Medical providers are not listening at all, right? We are absolutely deaf and dumb. But the question is, so when we do listen, when we do get feedback is, for patients, families, advocates, when they've used these apps, these digital CBT apps, the comment that I get the most often is something similar to this. It was cool, but it wasn't really relevant to me. Or another comment from one young lady was, there was no one on there that looked like me. And of course, in the digital CBT apps, they have a lot of, they have actors, other people that represent different stories about how they manage depression and anxiety and how they got through the CBT or the cognitive behavioral therapy themselves, right? And it's been loud and clear with every meeting that I've had is that in sickle cell, in this community, there is nothing for us without us. Nothing for us without us. And I've heard that from different groups, different places, different states, right? But I think that that's one thing that reigns true. And this is a little bit of psychology, science stuff, but to make things work with a group, we follow different types of theories, right? Just to simplify it. And this is really just understanding if there are different barriers, psychological barriers to something working in a group, what are those intervention functions? What are those interventions? What kind of things can we do to get over those barriers? So if there's a behavioral barrier, a psychological barrier to me not stopping smoking, what can I do to overcome that barrier? So if I don't know how to stop smoking, like say training, then you need to impart skills. You need to do that specific intervention. You need to do that specific intervention to help me understand or help me overcome that barrier of not knowing how to quit smoking. So the same thing is got to be with when we're doing digital CBT. Like we really need to understand what are the barriers to you using something that's going to work, or at least we think is going to work, right? And we've heard loud and clear, nothing for us without us. We understand that you need to see relevance. You need to see some representation on there. You need to have social opportunity. And the social opportunity is really the social cues and the cultural norms. If you don't see somebody else living with sickle cell disease using CBT, why in the world would you think that CBT works? Why in the world would you think that it works? And I've heard this again and again. They say, Dr. Charles, we love you and everything, but you teaching us how to manage our stress and our pain? No, sir. We would much rather have somebody that looks like us and has been through a similar experience. You want to have somebody who's actually experienced a sickle cell pain crisis to be able to say, yes, cognitive behavioral therapy works for me. Talking to somebody online worked for me. Doing these little skills, these little mental health hacks, they actually worked for me, okay? So what we did is we understood that social opportunity, that's a barrier. We connected it with a intervention function, and that intervention function is modeling. And essentially we took an app that already exists, we modified it because we said there's not enough relevant stuff in there. So that was this I Can Cope app. It was previously, it was created for kids, but we said, hey, let's take some of this content, because some of this content is great. We don't want to recreate the wheel. Let's take some of this content and transform it into something that's going to work for adults with sickle cell, adults with sickle cell and chronic pain. And then of course, we wanted to compare cognitive behavioral therapy to something. And so what did we want to compare it to? We wanted to compare it to what most of our warriors have been getting via online, social media, through the community for the last few decades. Education about sickle cell, education about pain. And no better than Sickle Cell 101 to use their content, and they've been delivering it to a large number of patients all across the world in a very effective way. So why are we going to try to come and reinvent the wheel for sickle cell education when they're already doing it? So we stole their content and put it into this app. But the key thing that we did for this CaRISMA app was we actually had warriors, adults with sickle cell disease, come and talk about stress, talk about pain, and talk about cognitive behavioral therapy and how to manage it. And then we also had warriors on the education side talk about how to learn more, or talked about the facts that are key to understanding your sickle cell. Because if you're empowered, then you're going to feel more self-efficacious. You're going to feel less likely that you're going to be overwhelmed. And of course, you're going to be able to better manage your pain. That's what we thought in theory. We were fortunate enough to get funding from PCORI, Patient-Centered Outcomes Research, to do a large clinical trial to see if cognitive behavioral therapy delivered by the people for the people and sickle cell education, or sickle cell education, was effective, and effective for who. Because the honest thing is we don't know. We don't know if for one person, education is going to be more effective. And we don't know if for another person, cognitive behavioral therapy might be more effective. But what we wanted to do was make sure that we had people from all over the country that were taking part in this study. So the University of Pittsburgh is a central site. We have 6 clinical sites. Now we're extended out to Vanderbilt. But the key really is for us is that we're partnering with the community. Sickle Cell 101, Sickle Cell Warriors, Sickle Cell Community Consortium, Children's Sickle Cell Foundation, and several other organizations, of course, Sickle Cell Minnesota, right? And through these these community-based organizations, we're really able to extend beyond just these clinical sites. Because what, people ask, Charles, what if I don't go to Duke? Does that mean that I can't participate in the study, or University of Illinois, Chicago? We eliminated all that. So now you can participate. You can just go online, you can get on your phone, on your computer, on your iPad, on your whatever, and you can be part of this study, because we felt like it's important, and the community said it was important for us to be able to reach everybody. All right. Unfortunately, if you're in Canada, you can't participate. So that is a limitation. Just in brief, I'm going to skim through this real quickly because I'm running out of time. I want to spend a lot more time in discussion than talking about the study. But again, we're comparing digital CBT and digital education. And the key piece of this, I've talked a lot about the education and cognitive behavioral therapy, but the key piece of this, I do not want to forget this part, is that every single person in the program gets a health coach. We know that if you want to get stronger, you can't just get into the gym by yourself. You can't just pick up CBT, pick up education and start doing curls and get stronger and get mentally stronger. You need to have a coach to support you and keep you motivated, keep you going, and tell you what you might be doing wrong, tips and tricks to make sure you're taking the most advantage out of the education or the CBT. So again, CBT works, education works. That's why we've been doing this in the community for decades. But the key aspect of this is that if you want to get stronger, if you want to be in the gym, if you want to be working out, you can get stronger by yourself, but the best way is with the coach. And that's why we want to make sure that everybody has a coach, and everybody in the program gets health coach support for 3 months. Of course, if you really need more additional support, or you really like what your coach is doing, we will try our best. And Dima might be, pinching me virtually, but we'll try our best to provide health coach support past that 3 months. But as you can imagine, the health coach support piece has really been a popular aspect, and we only have so much health coach capacity. But needless to say, you're in a study, you're going to get a health coach for 3 months. Now, this is how you get into the study. And I went through with just some pretty pictures. You come into clinic, or you connect with the CaRISMA website on your own phone or on your computer. You come into the clinic, you watch a nice little video. The video is actually of me talking about the study. If you like what I'm saying, great, consent into the study. Just sign your name right there on your computer, your tablet in the clinic. You do a couple of questionnaires right there. I know questionnaires are painful, but we need that information so that we know if this thing works. If it doesn't work, then there's no point in us doing it, right? The great thing is, as soon as you consent, our whole team gets an alert. It's like new participant. Yes, we all get excited. We jump around. We want to reach out. In the clinic, you'll have a coordinator or somebody on your team that's helping you get onto the study. Of course, one of the key things is the chatbot. I'll try to talk about that in a little bit. But the chatbot is what walks you through the cognitive behavioral therapy and the education. After you've gotten on the chatbot in the clinic or at home, that's it. Complete your questionnaires. Nothing else for you to do. You go home, you continue to work on your CBT, your education, and then of course, we're going to have a health coach reach out to you within 24 hours. Now, we want you to make sure you get on the chatbot. We want you to make sure that you respond to your health coach. You don't need to have a health coach the whole time. You don't need to talk with your health coach every week if you don't want to. We just ask that you connect with your health coach one time by phone, just so we know that you're a real person. And you never know, you might really like having a health coach. You might really like it. So just test it out one time. If you don't want to have a health coach, we let everybody who doesn't want to opt out. That does not change how you're compensated for the study or any type of or your involvement in the study whatsoever. But we just really ask that you contact the health coach at least one time. Of course, on a daily basis, we ask that you record your pain, but all the assessments, everything else comes straight to your phone. It's really nice. And then the key piece is, as much as you can or you like to, interacting with the CaRISMA chatbot, and go through all the education and the CBT lessons. And that is essentially the study. That is absolutely it. Now, we've done really well with the study so far. This is the largest behavioral study in sickle cell disease ever, which is great, but I do wish that there were more studies of non-pharmacological interventions in sickle cell disease. I'm really sad that this is the first one, but I'm happy that we're finally getting to do this. We now have 282 people consented. Now, to be randomized, this is the big thing. We want people to actually do the baseline questionnaires. And so I know they're a long set of questionnaires. I apologize about that ahead of time. So if you're getting onto the study and you're doing all these questionnaires and you're cursing at me, I'm sorry, forgive me, I'm sorry. But your information is going to really help us understand if this thing is working or not. All right. Now, of course, I got to give applause to all of our health coaches and our partners. There's, I believe, 12 health coaches we have on the team now. These are not all our health coaches, but we were recently able to meet in Fort Lauderdale and actually see each other in person. Like, can you imagine that? Actually seeing real physical people in person? It was absolutely fantastic. Thank you, everybody who was able to show up. I also got cussed out for showing a bad picture of the health coaches. So you can see that I've changed that now. So anyways, the number of people that we have contacted with our health coaches is about 200 now. But this is that at least I'm asking at least one session, just one phone call. And we've hit 78% of those individuals that have signed up have had at least one phone call. So I appreciate that. I think that's absolutely fantastic. That just speaks to how wonderful our health coaches are. The mean number of times we are reaching out to people is about 12 on average. So that's text message and phone. But you can see how wonderful it is having a health coach, because even as a clinical psychologist, I don't get 5 sessions with individuals. I don't usually get to that number. So I think that having on average 5 phone calls or text message sessions with each participant is a very powerful statement of how much work our health coaches are doing for the community, because most of our health coaches are actually not paid, it's volunteer, but also just the need to have somebody you can connect with, who validates your experience, who understands and who can help you navigate these rough waters in terms of stress and just managing the stuff that happens when you're living with a chronic disease out here in these streets. So, all right, just quickly, I'm just going to show you just a little bit of what the chatbot looks like. Oops. All right, maybe it won't. Technical difficulties as usual. All right, so the chatbot is really just an automated chat. You answer some questions, you go through, you click on different responses. Some of the responses you're able to type. But the nice thing is that we do have a lot of videos and ways for it to be interactive. We tried to make it as not boring, as exciting as we possibly could. Of course, it's education, you're learning. So there's a little component of it of, hey, you know, you really need to kind of put in your time. But, you know, Pat is asking a question. What I'll do is I'll just finish up this last part, Pat, and when I get to Mike Tyson, maybe I can stop, Ray. All right, the one negative thing, I'm going to give everybody a heads up. The messenger chatbot is on Facebook. And as you all know, Facebook has not had good press over the last few years. Data leaks, selling your data, etc. It is on the decline. And so there is the one thing that is stopping people from wanting to get on the chatbot. It is really the fact that it's on Facebook. So you have to access it through Facebook Messenger. That does not mean that you're on Facebook, but you're accessing it through Facebook Messenger. If you don't want to have your information on Facebook for any reason or anything affiliated with Facebook, we understand. And what we can do is we can provide you a ghost account. Okay. Of course, this is the number of people that have been associated or jumped on the chatbot, but there's a lot of people who have not got on. They have not got on. So that's the one thing. And I'd love for any comments and suggestions about how to fix this, or what we can do in the future to make sure that the CBT content and the education that we're providing, which we think is really rich and really helpful, to make sure that people are getting as much of it as they possibly can. But the key thing is for us, we are doing a large study for a lot of people during COVID in the midst of a lot of things going on in America. And so everybody's got a plan until they get punched in the mouth. And we definitely have had to dip and duck and juke and jive quite a bit to figure out how to make this study work. But the key thing is that I'm working with a lot of fantastic people who are really putting their blood, sweat, and tears into this. And it's really being on forums and events like this to understand, hey, how can we make this better and how can we make this work? So I got a couple more things, but I'll stop right here and see if I can ask or answer some questions.
So this is awesome. Let me go back on camera. This is awesome. And we actually have several questions in the Q&A. So if you have a question or you put your hand up, please put it in the Q&A because that's what we're going to do. We're going to speak from. Dr. J, did you want to finish? When you get done, there's a couple people that came in late, so I'm going to play your video just to summarize everything that you said, and I just love the video.
Oh, you're so kind.
But did you want to go back to your slides?
Yeah, unless there's burning, I'm going to leave the study now. I'm just going to talk about a couple of mental health hacks that we have, some key things that we talk about in the study. So.
Okay, let's play your video real quick, and then let's come back and let you do the let you talk about the last slides.
Perfect.
Okay, folks, I want you to take a look. This, for those that may have come in late, here's kind of a summary of exactly this program. I love this video anyway, but here you go.
What's going on, everybody? I'm Dr. Jonassaint, or you can call me Dr. J, but I'm the lead investigator of CaRISMA, a clinical trial built by the community for the community. Now, the word on these streets is that people living with sickle cell battle with pain on a day-to-day basis. In fact, you may be feeling like pain is the greatest barrier get between you and that life that you want to live. Well, that's exactly why we're doing this study, because we want to find out if warriors can teach other warriors how to better manage their pain and their life, but doing all this through a mobile phone. If that sounds interesting, let's meet some of the people living with sickle cell that make CaRISMA, CaRISMA. Wait, something missing here. All right, that feels a little bit better. Now, CaRISMA. This is a study for adults with sickle cell disease that experience daily pain. After we spoke to patients and families, we found out that second only to weather, stress is the biggest trigger for pain. So the goal of this study is to find out whether we can improve your health by either giving you strategies on how to reduce stress or by giving you more knowledge about your sickle cell and why you have pain. Our CaRISMA program is delivered by an AI chatbot called Cilia. Get it? Sickle, Cilia, Sickle. No, all right. You will interact with this chatbot through an app on your smartphone. Cilia will have some quick facts to give, simple questions to ask, so she can understand what you need and what you want to do next.
Okay, so for those who may have come late, that was just a quick summary of what Dr. J was talking about. I'm going to turn it over to him so that he can finish it out. And then we're going to open it up for Q&A. We want to hear your thoughts. We've already got a few questions in Q&A. So take it away and we will wrap it up.
All right. As we like to talk about in CaRISMA and with all the health coaches are going to be rolling their eyes because we talk about this all the time, but we do think that it's really the core to living well with sickle cell disease. And of course, I'm a mental health professional, so I really think that mental health is important. So if you want to get into mindfulness meditation, I say go for it. If you wanted to get into cognitive behavioral therapy or acceptance commitment therapy or DBT, dialectical, whatever kind of therapy you want, absolutely. But before you go that route, please make sure you have your 4 walls in place, because you can't put a roof on your house unless you got your 4 walls up. All right. So the first one is, everybody knows this: if you have sickle cell and you do not have a glass of water beside you, shame on you. All right. You got to have your bottle of water. Everybody knows. If you want a CaRISMA mug, I will send you a CaRISMA water jug They're really nice. They're actually Yetis. So hit me up via email. I will send with your address and we will send one to you. All right. Hydration, absolutely important. The second thing is nutrition. Warriors tell me time and time again, I change the way that I eat and I have been out of the hospital. The apple a day really does keep the doctor away, it seems like, for sickle cell. And there's a lot of evidence that suggests that eating appropriately, eating clean is associated with better outcomes. Exercise. We want us to be light on the exercise, of course. Moderate, light exercise. We're not in here unless it works for you. I know there's different strokes for different folks, and your body is best. But some activity, not sitting on your couch, not being a couch potato, so to speak, but getting out, being active, doing some type of physical movement on a regular basis is absolutely key. And the biggest one by far, apart from hydration, probably is sleep. About 90% of our warriors have some type of sleep disturbance. If you think back right now, when's the last time you've gotten a solid 7 to 8 hours of sleep? You're probably thinking back, looking into your mental Rolodex, and it's hard to identify that day. All right, either waking up inappropriately in the middle of the night or having difficulty getting to sleep. All right, is definitely a problem that we talk about a lot with warriors. We have a lot of sleep hygiene ideas. So my one tip for everybody, and I say this on every call, if you have a TV in your room, if you have sickle cell or not, if you have a TV in your room, get that thing out of there. Get the TV out of your bedroom. All right, your bedroom is only for two things: sleep and those other shenanigans. All right, so and that's for the grown folks. Anyways, all right. The other thing we talk about is you need to have confidence, right? And a lot of our warriors do have a lot of confidence, but there's times when you're going to be in pain, and you're going to be stressed out, and you're going to feel closed in and small. Well, there's actually data to suggest that when you feel small and you act small, then you start excreting these stress hormones, right? The wrong type of stress hormones. But if you look at animals in the animal kingdom, if you look at any type of Olympic champion, when they cross that finish line, when they defeat, when Mike Tyson, he's not going to look small, he's going to look as big as possible, right? Crossing the finish line, Usain Bolt, hands up in the air. Everybody has the same pose when they feel powerful. But when you do not feel powerful, you can pose that way anyways. You can pose that way even though you don't feel it. So you fake it till you make it. Doing that for just even 30 seconds, a little power pose, or as this young girl is doing, this little superwoman power pose, and you'll actually increase your testosterone and decrease your cortisol. You'll actually feel more powerful just by posing like that for 30 seconds. Even if you don't feel it, you're physiologically, your body is changing just by the way that you're standing. They even have data that suggests that if you fake a smile by biting on a chopstick, they can change how you feel and what your body is doing, improving your immune function. So this is a powerful thing. So fake it till you make it. Your body posture really does dictate how you feel and what your physiology is doing. All right. Pause breath. I know everybody's gonna say, you've been learning about deep breathing since you were like 6 months old, I understand. But this is an extremely powerful hack, not just deep breathing, because I just talked to my son about deep breathing the other day. He was trying to stretch, and I said, man, you just need to breathe a little bit. And so of course, what he's doing is, that's called hyperventilating. That's going to make you even more stressed out, right? So when we deep breathe, we don't want to breathe into our chest cavity because that is tight and there's not a lot of room in there to get oxygen. What you do want to do is just like singers and wind instrument players, they breathe into their diaphragm or into their belly. And what you can do is you can practice this when you're laying in bed, is put one hand on your chest and one hand on your belly and take a deep breath. If you take a deep breath and your top hand is going up, that is chest breathing, right? What you really want to do is take a deep breath and feel that belly stretch. It's going to be uncomfortable. Babies actually do this naturally, but as we get older and more stressed out, we do these short, choppy breaths into our chest. But if you actually breathe into your belly, you stretch that diaphragm. It's like a muscle. You stretch that. And even the stretching of the diaphragm releases these stress coping hormones and will actually relax your body. So part of the reason why deep breathing has not worked for people is because you've been breathing incorrectly. Maybe somebody's taught you incorrectly, I'm not sure, or we've gotten out of practice, but really deep breathing is one of those hacks that you have to learn. Now, this isn't exactly a hack, but this is one thing that we do teach in CaRISMA, and this is key for everybody. Now, we all have these stressors that are happening in our lives, and oftentimes we can feel overwhelmed. But do you ever experience that time where you feel like that you have this inner critic that is just telling you what a loser you are, how incompetent you are, how you're going to fail, how you can't do this? Has this ever happened to you? You have this little devil on the shoulder, and it seems like he's just stabbed a pitchfork through the angel on the other shoulder. And all you hear is this negativity. Now, we call that inner critic, call those thought distortions, and your inner critic will make you feel like what it's saying is reality. You are a failure. You've never done anything good. You will just never be a success. And it'll make you feel like that's a reality, but it's just your thoughts. And we teach you how to change those thoughts and make sure that you recognize that what you're thinking is not a reality. And we need to check on what reality is so you can change your thoughts. All right, so that's all I'm going to do for the hacks. I do have some more, but I do want to get to questions. Join at CaRISMASCD.com, and it's no H, CaRISMASCD.com. Check us out, and we will go to comments. Oh, there you go. Thank you very much, Demon. Oh, Ray, you're on mute. But what you were saying was great.
Fantastic. Thank you. Every now and then I still do that. This was wonderful. And it was a lot of information. And so I know that some of you have some questions. You've heard us mention the name Dima a couple of times, and she is one of the health coaches that has joined us tonight. And we're going to come to her in a second. But I do want to make sure that we get to some of these questions that are being asked. All right. So there's the first question that we got is, can we address about kids and stress? Because they're worried about fitting in with their peers, being in pain and missing school, and then trying to catch up with their peers. Schoolwork and catching up on missed assignments. I know the 504 can help, but with the missed work, it doesn't help eliminate the stress that kids with sickle cell can often face. So how do we as parents address or help them with this, even if they are seeing a therapist? That's a good question.
I know you're smiling because you're like, ooh, man, that was they hit that one out of the park. Oh my goodness, that was a fantastic question. It is. I've even heard from some of our kids with sickle cell that they don't want to make friends because of exactly that, because they're going to miss out on a lot of things. They are going to miss school, or they don't want to let people know that they might die, or that they might have to leave this earth and hurt somebody in that way. So it's tough for our kids. I think, and Ray, I'd love it if you spoke to this because this is really your area of expertise. My quick thing is I know a lot of warriors that have never met somebody else with sickle cell disease. And so just being part of a communities like this, I think is extremely powerful. We used to have sickle cell camps in PA, and then they stopped those. I know a lot of the states used to have camps, and those have decreased over time. Hopefully there's still areas for kids to be able to connect with others. And the other thing is, I think that it's important for kids to find something that works for them that they can carry throughout their life. So it may not be, journaling might not be it, therapy might not be it, maybe it's sports to a certain extent, or say maybe chess or something like that. But as long as, you know, just don't be discouraged by one coping mechanism or one activity doesn't work for them or they don't like it, it isn't glom on, just try another one. That's why we try to do as many tools as possible, because a wrench or pliers or a screwdriver is not going to be the tool for the job. Sometimes you need a jackhammer, right? So we just try to get as many tools out there, and then people will select, your kids will select the one that works for them. I just got to expose them to as many things as they possibly can, but keep trying. But Ray, please.
Yeah, no, I totally agree with that. And as the mother of a now young adult person living with sickle cell disease, we had some of these similar challenges. A couple of things that I would say is that recognizing that stress is a part of everyone's life, whether you have sickle cell disease or not. So the earlier that you start giving them those tools and giving them coping strategies around that, but I would also make sure that the school is not putting some sort of a level of pressure on them to keep up with their peers. Sometimes we get caught in comparing ourselves to the next person, and kids especially, it's very easy for them to be looking at their peers and seeing what they're doing versus what they're not. So the first thing that I would do is reinforce messaging in the home environment that we don't compare you to anyone else. You are an individual. We know that your life and your normal is not someone else's normal, and their normal isn't your normal. And then Dr. J, you hit the nail on the head. How do you introduce things that help them to enjoy life, that can help to alleviate some of the other stressors? So we started a program here at Sickle Cell Foundation of Minnesota called SickleSMILE. And that is supporting modern initiatives for life enjoyment. And it's all about finding the healthy things that make you smile and doing more of it. There is something special about when you have a hobby, when you have the things that you enjoy doing. It doesn't matter what age you are. We all need to incorporate the things that make us laugh, the things that make us smile, the things that take our mind off of the hard stuff in life. Kids too. Kids these days carry way more of a burden than the kids even when I was growing up. And so it's important that as the parent, you're going to be instilling many of these tools, but make sure you're communicating with the school. The school may not understand that they are presenting these demands. It's interesting because you can have a 504 plan where they have the accommodations, but yet the way that child is communicated with doesn't shift to accommodate the accommodations. They're still talking to them and interacting with them as if they don't have accommodations that they need, making sure they're not othered when they are utilizing those accommodations. But one of the best techniques we can do is a community-centered approach, and that is reinforcing to them through the community voice, through the parental voice, through the home, that they are special in and of themselves, and that regardless to anything, they are loved, and that it's all going to be okay. So no special wand answer, but it is a matter of just being present in your child's life and reinforcing love. All right. Okay, next question. Y'all got some long questions. Question. What about situations, this is good, where a child's home environment can be contributing to their increased pain episodes or crisis, and where there might be one parent who feels like they are more of the caregiver, another parent who might be a bit more nonchalant or have expectations that are beyond what that child might be capable of. They may ignore the pain, or they may be concerned about how others may perceive that child or the family or even them as a parent. When other kids are going to fun places and they may not be able to, how do you cope with that? Now, how does the other parent cope with that, as well as how does the child cope with that?
This is another extremely important topic that I don't think that we've brought up on any of these types of calls. So I do a little bit of marital counseling as well. Hopefully, we used to do a blog, my wife and I, but one of the things that we talk about a lot is, putting the child second, right? And the reason is because your child gets so much from watching how you interact in your relationship. And that does volumes in comparison to what you actually say to your child. Now you almost have to, it's tough to even say that when you're dealing with a child who has a chronic condition, and they really do need to be the priority. And I guess the thing that I would say is sometimes the focus may have shifted too far towards the kid. And I don't know if maybe I can read through it again, but sometimes we just do need to spend a little bit more time on our spouse, on our partner, on the other caregiver, and spending time just to kind of figure things out. Because a lot of times what happens is, particularly men in the relationship, we get jealous. We get jealous. I know I told my wife this. I was like, man, I see my little guy. He seems like he's taking my place, right? And regardless of how sick or hurt or how much he's crying, I still get jealous by that. And so, even though sometimes we may not act like it as men, we do have feelings, right? And sometimes it is really important to kind of take a step back and try to cater towards that, even if it feels like you may be neglecting some of the duties with the child. But Ray, please speak on that.
Yeah, I think that that's a difficult one, because I think that there oftentimes is a lot of inner feelings that are being masked. And so that other parent who may not be as involved, there may be guilt in their contribution of their DNA that they had no control over, right? But it's really about addressing the marriage relationship. I love that you said that, Charles. And it's really hard as parents, and it's particularly as mothers, to hear that maybe I'm giving too much attention to the kids. But I think it's about the balance. I think it's about balancing the home. You might have multiple children in the home and those children may feel like the child with sickle cell disease is getting more attention. How are you making time for those other kids? Is it, maybe a night out a week, a month, or something that allows them to feel like that they are still part of this family dynamic? And as Dr. J said, that even goes for the big kid, the husband, right? Just making sure that everyone understands that they all play a role in the family, and that they're all important, that they're all loved. We can easily respond out of a defensiveness, especially as if there's one parent who feels like that they're doing or carrying most of the weight. It's easy to feel defensive in those moments, and it's understandable why you might. But I would and I've seen this situation time and time again. I would suggest just taking a step back and saying, what can we do to keep the marriage healthy while we keep this child healthy? And that may take some additional therapy. That may take a third party that can come in and help to kind of diffuse some of that and help communication. Is there opportunity to learn different communication techniques? So I'm not a therapist, and so there's my disclaimer. I'm not a therapist. So, but I give my lived experience. I give the experiences that I've had having being in this for 17 years. There's never one magic answer. You may have to try several different things, because we all are unique in that. And so I encourage that everyone should understand that they are loved and that they have a place in the family dynamic and the structure, and nothing is going to change that, whether they have sickle cell disease or they don't.
Yeah, no, I love that. I think that's absolutely beautiful and spot on. I love that point about, sometimes there's guilt, and everybody manages their guilt in a different way. And although it may look maladaptive to you, that's the way they're coping with it. The other thing is, and definitely wanted to bring up, is that sometimes on both sides, you're dealing with compassion fatigue. And Dima, one of our health coaches, our health coach manager, she did a great lecture on this for all of our health coaches, because sometimes it is more than just burnout of feeling like you just don't have enough to help and you're not able to do anything. You're kind of like stuck in the mud of trying to help out. So great.
I'm actually going to promote Dima to just say a few words. We still have a couple more questions, but Dima, can you just kind of give a quick summary of compassion fatigue, because it is real?
Okay, well,
I know we were going to have you talk about something totally different, but you're still going to talk about being a health coach. But yes.
So basically, compassion fatigue is when you feel totally, completely burnt out, or not burnt out, but tired of giving of yourself. And as a health coach, and as you know, I'm also an engagement counselor for another company, and I work with homeless youth and trying to transition them. And it burns us out, and we hear the same story over and over again. And sometimes our feelings, are what the participant may feel, gets transferred to us. And so oftentimes I go home feeling defeated and feeling depleted. So what I'm teaching the health coaches is how to train themselves to shut themselves off, and also implement self-care and writing out their thoughts, and doing all the things to make sure that they're not exhausted by someone else's story. So that's what I just say right now.
Awesome. And do you want to just say a few words about the benefits of being a health coach with CaRISMA?
Okay, well, there's so many benefits of being a health coach. I think one, I get to work with for a prestigious university as the University of Pitt. I've learned so much with Dr. Charles and the team. I also work with Dr. Charles's father, Jonassaint, and he is a brilliant, brilliant man, and he's behind a lot of the tech. So I've been just soaking up all of this knowledge, and I think that's one of the best perks of working for Pitt. But also as a health coach, I get to talk to other warriors. And before this sickle cell journey, I felt so alone, because I'm also a warrior. And I felt so alone because I thought I was the only one going through what I was going through. But the exchange of just having the conversation and saying, oh, wow, I go through that too. Sometimes it's sad, because it's like in a world where there's so many social economic things that are happening because of sickle cell disease, but it's just rewarding to know that, hey, I'm not going through this alone as well. So that's a couple of the many benefits.
Absolutely. And in some ways that goes hand in hand with what Dr. J said about for kids, making sure that they feel part of a community, that they are seeing others in the community who also have sickle cell disease, so that they don't feel different, othered, isolated. This is where we see a lot of the isolation begin. And I worked in the clinical setting for many years, so I've seen hundreds of families. And isolation amongst people living with sickle cell disease starts very, very young. And it often is a detachment for lots of different reasons. But one of what you brought up as a parent is one of them. And a couple of other things that have been brought up is where that detachment begins to happen. And it starts to happen mentally, and then it kind of transfers into emotionally. And that's where depression, that's where high levels of anxiety, because the body stops processing it in the healthy way that it's designed to. And that's where what I love about this program is it's about giving new tools or retooling what many of us may or may not have learned growing up and through our life experiences. So I love it. I'm so glad that you're here, Dima. I'm glad that you are doing what you're doing and working with the Jonassaints with the S. So, all right. One more question. Well, actually, there's two more questions. One question and a comment. Pat's question is, if a client is compromised related to being able to read or write, so if they have any kind of reading or writing deficiencies, how does this program make accommodations for those individuals? That's a fair question.
No, that's a great question. We actually discussed that when we started the program. What we wanted to do, unfortunately, PCORI did not provide the funding, just because that's the way that it's structured. But what we wanted to do was take the chatbot and put it into an Alexa device, like one of the home devices, because the videos could be played on an Alexa show and it could talk back and forth with you. So the same chat that we have in Messenger, Alexa could speak that to you and you could speak the responses back. And that's what we wanted to do. I think that that will be CaRISMA 2.0, but it's a perfect question. In fact, we end up eliminating a lot of folks who do have challenges with reading and writing because there is a little quiz in there. And if you aren't able to read through the material, you'll just automatically be kicked out. So yeah, thanks for bringing that up though, Pat.
Thank you. I love that you brought that up. There's a comment in the box about the way that CBT is presented to families. So one of my biggest pet peeves is physicians who introduce clinical trials or introduce, gene therapy or other curative therapies, and they're not the experts. So they're going off of what they've learned along the way. So sometimes the way that it's presented is not as thorough as someone where that's their expertise. So what the person was saying is that when CBT was originally brought to them by their physician's assistant in the hematology setting, it felt like they were saying that it would be a replacement for pain meds. Well, we know that's a trigger for all of us, whether you are the person living with sickle cell disease, the caregiver. Once you even sound like you're going down that road, mama bear and all that other stuff comes out, right? But then when she spoke with the person who actually does CBT, they were able to explain it in a different way, that it's more complementary, meaning it works with the pain meds. It allows the brain to function differently and to balance what it's feeling and then what it knows and the tools that it's been trained to have and the way that you think about what's happening in that moment. So it's not a replacement for that. Now, what we do know is that as your cognitive behavioral skills improve, you are going to have improvements in pain. So you'll need less pain meds, right? That's really what the goal is that as you have more tools, your body will respond differently to some of these stresses so that it doesn't always trigger the pain, or at least it doesn't trigger it to the same degree, right? Am I saying that right, Dr. J?
Oh man, that's fantastic. I think that a lot of physicians seem to believe that patients with sickle cell disease want to be on opioids. And I've spoken to warriors across America at this point as part of the program. And there are so many warriors out here who are staying away from opioids, want to cut down on their opioids. That's part of the reason they get onto the program. Absolutely, I agree with you. We even say in that video, the intro video, we are not trying to stop. We want you to continue on your current regimen of opioid. We do not want you to stop taking opioids. And that's exactly it. We feel like that you need the opioids just to be able to focus on the CBT portion. If you're changing your pain regimen, how are you going to focus on training your mind? Like this is the CBT piece is a little bit of a long game. So we really want your pain management to be in place so that you can focus on that and really train your kind of cognitive behavioral skills to make sure that it works for you. So absolutely.
Yeah. I appreciate that response. And then right now, it sounds like that this program is geared towards adults. Yes. And as you said, in CaRISMA 2.0, some other things that can be implemented, but it's about, we want to make sure that we get the support and that the funding is there, right? We have to make sure that that we have disparities in funding. And we know that there are other conditions that seem to be weighed differently. And so more money is given. This is where you all can help to be advocates and you all can continue to use your voice in the legislature. We are still working very diligently to get funding for the bills that have already passed for sickle cell disease. They can pass a bill and then not give no money to it. I didn't know that till several years ago, but it's true. So now we fought for the bill. Now we have to fight for the money. But we're not going to stop. We're going to do exactly that for these types of reasons. As Dr. J said, this is the first study in the sickle cell population with CBT. This should be the first of many studies in this area because we know that this works, and what we want to do is show that it works. Once you have the data, the dollars start rolling in. It's kind of backwards, right? We We need the dollars to get the data, but they want the data to get the dollars. So at any rate, these are all important things. This is why we have shows like this. The Living Sickle Smart is about, unapologetically talking about the things that matter to the people who it matters to. And so we provide this platform to people who are doing great things in the community, to people who are talking about and explaining what it means to live well with sickle cell disease. We have our Sickle Smile program, because everything isn't about education. We've got to learn that quality of life is not just about being physically healthy by taking our meds, going to the doctor, but it's also incorporating fun. It's living. Quality of life is living to the best of your ability and being the best version of yourself while you're doing it. I love that we had this conversation. I want to make sure that we are thanking all of our attendees. Dr. J, you put your information up there. Am I sharing the screen?
You're sharing your the presenter view.
No, I don't want to do that. I want to share this view.
As you're popping that up, for anybody who's interested in being a health coach, just remember, you do not have to be somebody living with sickle cell disease to be a health coach. Absolutely, obviously, those who live with sickle, we encourage you to become a health coach. But advocates, family members, just anybody in the community who has passion about this population, we would really love for you to serve as the health coach. But more importantly, we need people on the study to show that it works. That's
yes, yeah. So we need health coaches and we need participants. And give it a try. Don't talk yourself out of it. Give it a try. It might be something new. You may not fully understand it, but give it a try and learn it as you go, and just give it a chance. Again, thank you so much, Dr. Jonassaint. Pittsburgh Medical Center, there's the website for the study, as well as Dr. Jonassaint's email. Don't blow him up too bad, but if you're interested in learning more, participating in any way, shape, or form, please reach out. You can send your information for the water bottle directly to his email, or you can email us at events@SickleCellMN. Just a couple more things. We do have more sessions coming up. With Living Sickle Smart is part of what we do. So next week, on next Thursday, we have a session for correct use of IV fluids in a sickle cell crisis. We have pharmacology. I'm really excited about these, because how a good pharmacist can save your life. How many people have a pharmacist on their medical team? Not enough, right? So let's learn about why it's important that we do. And then we also have our other activities and events. This week, we had our first Cooking for Your Health live cooking demonstration. We had a blast, y'all. It was so good and it was fun. It's part of our Sickle Smile program. Of course, we have our community wellness walk and talks for wellness. Those are small group discussions where your voice matters. We talk about the problem for 10 minutes and then community-centered solutions for the 50 minutes. All right. So, and then of course, our walk for sickle cell happens in August, and we hope that you can join us. Last but not least, you hear me say it a lot, our voice does matter. At Sickle Cell Foundation of Minnesota, we've created a form because we want to hear your feedback about your experiences with the medical system, whether you've had a good experience or a bad experience, and we do want both. We want to hear about it so that when we are blessed to be at tables of influence, that we are telling real stories of real people. No, we don't use your name, but we do want to make sure that we have real examples of what's happening in the community. That Ray is apologetic in what she says. So when you invite me to the table, you are inviting my voice, my mouth. Okay. And I'm going to speak on behalf of this community because I love this community and I love what I do. And I've been blessed to be given a platform in which to do that. So I'm not here to play games. But I thank you all for coming. Dima has put her email in the chat as well. I see a couple of other things. Tabitha, I thank you for that. I've seen you at many of our sessions and I love it. Continue to come, sign up. Oh, by the way, within about 24 hours, the replay of this session will be uploaded to our YouTube channel. do yourself a favor and subscribe. That way you'll be notified whenever we upload new sessions. And then also you can subscribe to our Eventbrite channel, so you'll be notified when we have new events that you can register for. All right, anything else you want to add, Dr. J? Because I talk a lot.
No, I think that wraps it up. It's beautiful. We'll see you all next time.
Awesome. Dr. J, stay on. Thank you all for coming and participating. Thank you for the great questions. And we'll see you on our next Living Sickle Smart with Sickle Cell Foundation of Minnesota.